walk-in clients at this time. We've canceled all outreach events. The state hygienic lab said they weren't going to run any of our samples from those anyway. We're doing a client pre-screening, so we're calling all of our potential clients in advance, seeing do they have symptoms, but also do they have any chronic health conditions that might make them have extra complications should they acquire COVID-19. We're using a clinical decision algorithm from the CDC. I'm not going to click on that because I don't want to like ruin my technology, but it just lists out some of the conditions that we screen for, and I'd be happy to pass that along. And then we began to discuss some alternatives like telehealth, our walk-in medical clinic, and then if someone really truly needs some like an HIV test, we were prepared to let them in through like an alternate entrance. Through telehealth, our PrEP provider is having a conversation about adherence and frequency of testing to determine if the PrEP prescription can be extended temporarily, or if we really should be getting that HIV and PrEP lab going, in which case if someone has a telehealth appointment, they then later come in for a nurse visit to just get those labs quickly drawn and back out the door. So what is our messaging around sex during this time? For me, it's been kind of helpful to be clear about what our purpose is as an organization, and that really is HIV prevention. And so I think it's important that we don't try to like solve all public health crises at once. And so while yes, COVID-19 is a public health crisis, it's secondary to our mission. People look to us for guidance around sex, but I don't think that our little team can prevent COVID-19. Our mission is still HIV prevention. That being said, we're definitely a harm reduction clinic. So what is a harm reduction approach? We know people are, still having sex. So how can we help them to have the healthiest sex possible, or just make informed choices? Maybe they don't care about COVID-19, but at least they know this sexual behavior may result in this outcome. We do use the NYC health directives that came out early, which were awesome. And then I hope y'all are connected to the Counter Narrative Project, but those guys put out awesome content. And so I was on their vlog regularly, seeing how they were talking about sex, intimacy, baiting, self-pleasure, and all that great stuff. So that really informed my approach early on and our approach in general. Social media strategy, keeping people abreast of our changing appointment criteria. We used it to share messaging about sex, that harm reduction approach. And we've increased our prevention content due to some furloughs in the marketing department. We kind of took on some more of the responsibilities there. We had some blog posts. I wrote one myself about how I was handling my mental health, talked about, what I'm doing with masturbation right now, and just like kind of an open conversation on that. And I'll talk a little bit more about one other initiative that we are trying out. With our actual HIV STI appointments, we're making them shorter and to the point. There generally is a little less risk reduction counseling. We're trying to balance possible exposure to COVID-19 since we are in a federally qualified health center and have had patients test positive. We're trying to balance that with also the need to do risk reduction counseling. Our regulars kind of already know what we're about, so we might take a little bit more time with people who are new, but in general, we're keeping it pretty short and sweet. And we set that expectation early on in the appointment. We're not being rude. We just want to do what we can to keep you healthy. We're using appropriate PPE, and then we put together a half sheet update that includes most of our risk reduction talking points. And we do leave the room while we wait for a determined rapid test result. We take that test with us and then return when the test is completed. Normally, we would use that time for risk reduction counseling. This is a little testing update that Michaela and I put together. It includes our main risk reduction talking points. So rather than maybe covering those verbally with folks, we're providing that as a handout, or we leave them to read it while we're waiting for the determined test result and then come back and ask any questions that they might have. Obviously, caring for our team is really important. So my manager has been really good about doing daily prevention check-in meetings. Our employee assistance provider has facilitated some group conversations. We did a lot of self-care webinars. One thing that I think is really important is that we do reduce the number of available appointments right now. Before, 2 people were seeing as many as 7 people a day. At this time, just 1 person is going to see around 4. And it may seem stodgy, I guess you could say, but it really is important that we're taking care of ourselves. And I feel like, for me, I'm doing like half the work, but becoming twice as tired. So I think this has been really key. Other things, we're bringing our dogs in during work. Our Part B team earned an incentive from the Department of Public Health, and they used it to buy a massage chair. So that's awesome. And then lots of good listening between each other. So in the works, a curbside condom pickup. We just launched a Google form that allows people to place personalized orders for condom, dental dams, and harm reduction supplies. We are set to launch a limited test at home program for the Aura Quick in-home test. We're going to be first rolling that out to our folks who are seeking a PrEP prescription renewal, but don't want to come in or are unable to come into the clinic. And then if successful, we may expand that test at home project to other individuals down the road, which I think is one of the silver linings of this health crisis, is that all of us are, having to innovate, which I think is a good thing. So that is a brief overview, and I believe we'll be taking questions earlier, but thanks for having me today.
Thanks, Noah, for sharing. Thank you. That's really great to hear about the work that you're doing and how things have been able to continue and shift. Of course, I feel like a lot of healthcare providers are definitely utilizing a lot of telehealth more now than they did before. And it's so crazy because pre-COVID-19 world, way back then, when we were in the process of creating the Ending the Epidemic plan, and we were going from different towns to talk about things that were desperately needed, telehealth was one of the things that came up a lot. And it kind of just highlights how access and transportation can be such a huge barrier to healthcare before, but then even in a crisis situation, those issues are just exacerbated and highlighted. Another thing that's been highlighted, I think, is also just like all the just arbitrary barriers that a lot of people have to go through when it comes to accessing healthcare. And, we've seen a lot of loosening on restrictions, and I'm just thinking like, wow, I wonder if we can continue that moving forward. But thank you so much for sharing that. What we're going to do now is we're going to start with some questions for our panelists. Throughout the conversation, if people who are watching have any questions, please include them in the chat. But of course, we'll have time for questions later at the end, but we'll go ahead and get started. All right, so first question will be for Noah. Many people are continuing to engage in physical intercourse during quarantine and may be experiencing symptoms of an STI, but are unsure of who to talk to. What would you recommend as next steps?
Ooh, cool question. Well, we try to kind of consult with folks. So I don't know why the blank screen is showing, but can I still be heard?
Yes.
Okay. All right. So yeah, we try to serve as a touch point for people. So we, hopefully can field initial or incoming questions and direct people in the proper direction. One thing we are doing in the past, we might have people who are experiencing STI symptoms come see us for a free test. And then when the results come back, go ahead and get treated. At this time, to reduce the number of visits, we are encouraging those folks to go straight into our walk-in clinic, just get treated prophylactically, which most of our providers are okay doing, and then following up with any other resources.
Awesome. Oh, I just remembered that Damon had some comments that he wanted to make. So before we continue the questions, I'll let you go ahead and share some remarks.
Well, thank you. I did, and I really want to make sure too that this is a dialogue, because I think this is such an important subject. And I also wanted to make sure Tanya had some time as well, because I'm very interested in hearing what Tanya wanted to say. So I guess for me, I come more on the mental health side of this, and trying to understand in this incredibly confusing and uncertain time, what are lessons we already know, or what might be tools extracted from the AIDS crisis that might be of benefit here today. My work began in 1991 in the San Francisco Bay Area, and preventing HIV, doing HIV education and prevention. And at that time, we were still in the middle of the pandemic, and people were dying from a virus. And by 1991, we knew pretty well how to prevent that virus. If people use condoms only, condoms only, condoms only, that would be the way that people would do that. And so the message in the whole community, and the message that I had with Stop AIDS Project in San Francisco, was condoms only, condoms only, condoms only. And I would run around literally to bars and clubs and friends, and everything was condoms only, condoms only. And everybody was like, yeah, you're right, condoms only, condoms only. We're gonna do condoms only. And I was like, good, that's how we're gonna stop AIDS. But what happened? One by one by one, my friends, my clients, my colleagues, my roommates, my lovers were becoming newly HIV positive all throughout the 90s. And I thought, how is that possible if we're all using condoms only? And eventually a friend of mine said, here's the truth. I wasn't having sex with condoms only. And I couldn't tell you that, because your message was condoms only. And I knew you were right in terms of preventing AIDS and HIV, but that wasn't really the reality. And so I couldn't feel like I could share that with you. And when someone said that to me, a very dear personal friend told me that I wasn't safe, that I was not someone that they could come to talk about ambivalence, about sexuality, I realized that I was not doing a good job of being a friend, a human being, a therapist, a community member, and realized that the message had to shift, not one from condoms only, but one that also allowed conversations and discussions around what is it like to need and prefer touch from another human being without condoms? What does sexuality feel like in a way that embraces the beauty and intimacy versus the stigma and the shame? And I began to understand how to facilitate these conversations in ways that would allow people to share both their fears and their joys as far as connecting with another partner in the middle of the AIDS pandemic without condoms, and how necessary these conversations were. Well, after that came treatment, after that came PrEP, after that came U=U, and we got very far. But the last few weeks, I feel like I'm in a big deja vu. Because now, instead of condoms only, we're using the term social distancing. yes, social distancing is being talked about everywhere and it's this big thing. But now where we're getting to that is that if you're not social distancing exactly the way they are telling us to, people are being shamed, they're being stigmatized, and they're afraid. They're afraid to talk about it. They're afraid to talk to their doctors, their nurses, their therapists, their friends about, if I am not going to do social distancing 100% correctly, are there ways that I can have intimacy, sexuality, and touch in my life that don't significantly put myself or my partners at significant risk of death? And if there is a way, can we talk about that way? So as a therapist and as a community member, that's what a lot of these discussions have been about, especially now in the last 3 weeks. Here in New York City, you know, we're the epicenter of this. And starting around March 21st, when those guidelines that Noah shared, the sexual guidelines from the New York City Department of Health, everybody was kind of in it. Like, it was kind of like, everyone was like, okay, if we all do this together and we all band together, we'll all fight this thing together. And in a few weeks, it'll be over. Maybe a month, but by May, it'll be over. Right? That sounded good. And now we're way past that. We are in May. And the message here is, this isn't an acute crisis. This is a chronic problem. This is a new way of life. And we don't know when it's going to end. And with that, there's a very different mentality coming about. People are feeling tired. They're feeling burdened. They're feeling scared. And what these guidelines are ignoring are some fundamental principles that, in my experience, and if you've heard me talk about PrEP, you've heard me say, let's start with the foundation. Sexuality is a beautiful thing. Connecting with another human being is a healthy activity. And touch, human touch, consensual human touch, is necessary for our thriving, for our surviving. And now in the age of social distancing, we are being told to go without all of those for an indefinite, never-ending amount of time. Well, guess what? People ain't doing it. People are not doing it. And every day I'm having new conversations with my community about this. And again, it reminds me so much of those condoms only extreme days of the 90s. People seek touch, people seek connection. And using a harm reduction framework, maybe there's ways that we can be part of that decision-making process in ways that reduce the possibility for harm. I just want to give a quick example of what that looks like, or what that could look like. I'm going to give my own example. I took PrEP every day for nearly 9 years. I started in July of 2011 on a daily basis. Well, come March 21st, 2020, I'm like, I ain't gonna be getting any. I live alone. I am in Brooklyn in an apartment. I know I'm not gonna be having any sex, so I stopped using PrEP for the first time in about 9 years. And so 4 weeks went by. And after 4 weeks, I was like, okay, I still couldn't get a COVID test, but I was like, I haven't had any symptoms. I don't think I'm at risk for COVID. And I started having conversations with another friend of mine, a sexual partner who I've been with, who is also in an apartment completely by himself for the last 4 weeks, with no exposure to COVID, with no symptoms of COVID, with no contact with anyone in a vulnerable community or an older adult whom he might hurt if he came into contact. And he and I started talking, and we decided, you know, you've been in isolation, I've been in isolation. It's been 4 weeks. Let's talk about ways we want to get together to be able to have sexuality, intimacy, and connection in ways that would reduce harm. And so with that, I started going back on PrEP on the 2-1-1 strategy versus the daily strategy. And it's been a nice thing. So what I'm asking people to do right now is just to think about this critically, strategically, and to weigh the benefits versus the cost. If you do live with an older adult, if you are in contact with someone who is at greater statistical risk of dying from COVID, you don't want that on your plate. You don't want that in your karma. You don't want that in your wheelhouse, and you don't want to talk about that with your therapist for the next 30 years, then maybe this is not the time for you to be sexually active with another person. But if you are relatively certain that you are not going to be in contact or possibly hurting or killing another person, and you are in isolation, and now we can get tested in New York City. So if you're testing negative and you are with a partner who is also in isolation, is there a way? Is there a way to reduce harm? Not eliminate harm, but reduce the harm that might come from a sexual experience at this time. And does that sexual experience outweigh some of the anguish and loneliness and touch starvation that people are going through by being told to curb their natural impulses for an indefinite amount of time? I don't want to go on and on, but I just want to throw out some ideas to you. I wanted to open these ideas and thought that we could certainly have a dialogue about that. I don't ask people to agree with me. I would actually invite questions or thoughts or concerns about the material I'm saying. But I do hope that we can have a discussion that might be a respectful conversation and really might take these very basic, very real human experiences into consideration.
Thank you, Damon. You brought up a lot of great points and a lot of great information. And, even Omar is mentioning in the comments, shame and stigma are real and people feel that in a dangerous way. And, I feel like that's one thing I really want to unpack is the feelings around having sex or not having sex during this time. And I'm going to pass it off to Tanya. For those staying with family and or friends and choosing to engage in intercourse outside of their house, how can they deal with guilt coming from those they're staying with, or maybe even from themselves?
Thank you. I think both Damon and Noah framed it so that I can address this question in multiple ways. And the biggest thing is that both being sensual and sexual are human and natural parts of who we are, same as guilt, right? It's a part of the human experience. And so what I think is that we have to think about managing both our sexual desire and managing our guilt. And what most important that Damon offered up is you're going to have to make an informed decision so that you understand what the risks are in terms of harming someone else. But most importantly, you also have your own desires, right? And so you have to manage that. So what I think is that you have to consider how you're going to make this choice. I have family members who have partners who have decided, instead of dealing with the guilt of possibly exposing their family members by going in and out of the house, they've made a calculated decision to stay with a partner. Because that's going to make it less risky to transmit COVID, and they still get to meet those sexual desires that Damon is offering, like the skin hunger and the need to just be intimate, and not necessarily through sexual intercourse or penetration, but just closeness, physical closeness. And that's important to do. I think managing the guilt is going to be a personal way that we all have morals, right? And so our moral calculators look different. And so we have to give ourselves some grace to understand that we have these human desires, we balance it out with our morality, and we make the best decisions that we can. And if things become overwhelming, to actually utilize some of the telehealth opportunities or counseling, or even talking it through with a friend. The coolest thing you could ever do, if people have done it for years, is writing that list of plus, delta, or pros and cons. Before I make a decision, what are the benefits and what are the costs? And that's a way to make an informed decision. And managing guilt is something that you have to learn how to do through your own way of managing your morality, but you can get assistance from others. And I do want to give a shout out. Today is May 7th, and Noah made me make sure that I remembered as he was talking about self-pleasure. So today is National Masturbation Day. It's Masturbation Month. I want to offer up one of my idols, Dr. Jocelyn Elders. 1995, May 7th was the first day through one of the local sex product agencies to affirm National Masturbation Day. So I want to plug that. And that also is a moral decision too, right? Some people enjoy masturbation, where others it causes a lot of moral conflict. But I just say do what's best for you.
Yes. Speaking about masturbation, being at home with or without intimate partners has been challenging for some and eye-opening for others. What are some things people can do to become more in tune with their sexuality and adapt to their new setting?
I'm assuming that's for me too.
For
And
sure.
I'll jump in and then Damon and Noah, if y'all don't mind.
It's for you, but I would like to open it up after you're done to Damon and Noah if they have anything to share.
Perfect. So one of the biggest things I was thinking about is like introspection. This is a perfect opportunity, if you haven't done it, to really reflect on yourself, things that you like and things that you may not like as much or definitely couldn't tolerate. And a lot of this in regards to partners involves communication. And so if we're talking about intimacy, that's a critical part of intimacy, which is communication. Not only to talk about just overall day-to-day things, but to communicate your desires. One of the things I would like to offer up is a way to play games, use worksheets. My colleague Shamira, sexologist Shamira, has a card game called Use Your Mouth. And you probably would think it's something else, but it's not. It's about communication fully. There are little cards that you get to answer questions about your relationship and your sexuality. Afrosexology, if you go to afrosexology.com, I'll put all the stuff in the chat box. They have a worksheet to talk about like things that you like around pleasure, or making you think about your own ways to obtain pleasure with or without a partner. And then you can just do something called real talk and communicate, letting your partner know, hey, I like when you do this, but I'd like to try this, or I'd appreciate if we did this, like having that. A lot of us are in spaces where getting time alone is very hard, but it also is important to step away. And even if it's in a bathroom by yourself, if you can do that, wherever you can just spend some time alone. I think those are good strategies for this whole quarantine situation.
That's helpful. Damon, you want to share some things?
Well, I'm all about awareness. And I think anytime, whether it's imposed or not, we get a different perspective on something, it often can be very healthy and it can help us learn. And so I think for me and for a lot of people, getting sort of a break from sexual contact or getting some sort of pause is an opportunity to learn. And I think it's an opportunity. What I'm hearing from a lot of people in this community is that, there's a fair amount of time and effort that goes into having sex, pursuing sex, getting ready for sex, actually having sex, going home if you go home afterwards. So during this sort of pause in sexual encounters or accessible sexual encounters, there's a lot of people that are saying, oh, if I am not focusing my time and energy on that, what do I spend my time and energy on? And that's a really interesting question. So, people are sort of getting back to saying, well, I still enjoy learning. I still enjoy reading or watching something on TV or, learning a language. So that there's opportunities to make sure that, and I think even during the best of times, it's really important that we balance mind, body, and spirit, that we're always learning things, not just about sexuality, but about how our spirit can be enhanced and our minds can be enhanced. But a lot of times, especially, when we're feeling good, and especially now in the era of PrEP and U equals U, where a lot of us who lived through the AIDS pandemic have been very focused on the body because we couldn't do that without fear for 2 decades or 3 decades. And so this new idea or this relearning of balancing body, mind, and spirit, I think could ultimately enhance the life experience in the long run. And again, for people to just get back to, as we said, masturbation. And cheers to Jocelyn Elders, because she caught so much heat for that. I remember when she said that, I think she was fired after that, but she is a hero. But this idea of saying, okay, if pleasure may not be available or accessible to have with another human being, how I can return to learning how to give and receive pleasure to myself, which is a very important message, again, pertaining to the body, the mind, and the spirit.
Excellent. All right, I'm gonna ask another question. I think it'll be, I guess, for Damon and Noah. Tanya, if you wanna, of course, chime in, that's fine. But apps like Grindr, Scruff, and Tinder are giving their regular users membership benefits, such as increased profile viewing radiuses, seeing who has already viewed your profile, and surge nights. how do you think this affects people's choice to or not to have sex? I know like maybe people may not be even aware about some of that. I know we were having some conversations before the webinar that we didn't know that some of these functions existed, but apparently they're out there. Do y'all want to talk about the likelihood of having sex or not having sex with the apps in this time given these features?
I think it's great. I think it's a way to connect with a lot more people. I've been using it, and honestly, you might think that people are having more sex, but maybe they're actually chatting more and not necessarily engaging sexually. So yeah, I think it's a fantastic way to connect with more people in different ways. And of course, having sex with those new faces is great. But yeah, I've learned a lot about some new folks. So I think it's a plus.
Yeah, I think connection, overall is a plus. And some people have said, well, aren't those apps enabling the breaking of the social distance guidelines? And it's like, well, we didn't have Scruff or Grindr in the 90s, and look at the HIV rates then. Gay men don't need an app to have sex and hook up. We're going to do it where we're going to do it, when we're going to do it. That's not new to the 21st century by any stretch. What I agree with Noah. I think what these apps can do is often allow people to have communication and contact that might not be about physical touch. Or if people do go that way, if they're considering that, it allows them to have a conversation ahead of time. And again, this is based, right now I feel more comfortable with conversations I've had with people in the past, people who I can trust, people who have been honest with me in the past. But to be able to have a conversation like, okay, talk to me about how you've been feeling the last 14 days, the last 30 days. Have you had any symptoms? Have you been exposed to anybody who's had any symptoms? Do you live with an older adult or a member of a community that might be more vulnerable to dying from COVID? We can have conversations like that on the apps that are very easy to have and that facilitate that conversation. And I do think the apps are a benefit in that way. And also for some really alleviating that sense of loneliness that so many people are experiencing right now.
Mm-hmm. You mentioned earlier that you were on PrEP and then I think you said you maybe stopped now recently. So let's say if there are other people who are similarly situated and they're taking PrEP, do you think it's worth it to continue taking it or not? And like, what should people be considering in making that decision?
So PrEP, I always say, yes, we know from the medical point of view, the medical purpose, the medical guidelines all say the intention and purpose of PrEP is to prevent HIV first and foremost. And yes, I agree with that. But what those guidelines don't mention and what they don't include is how PrEP for so many gay men are taken for anti-anxiety. And what I mean by that is that there were so many of us that went through the AIDS pandemic, some mysterious virus killing all our friends. Does that sound familiar at all? It was real back then. And a lot of us grew up and went through that, losing people we loved to the AIDS pandemic. And that's traumatizing. And that's a trauma I'm always going to live with the rest of my life. And a lot of people in my cohort are always going to experience. And that there was never an opportunity when we were developing sexually to ever decouple sex from death until PrEP came along. And so PrEP, which I started taking when I was 40, was the very first time in my life that I could ever experience intimacy without fear of dying from it. So for me and for many people, PrEP is not only preventing HIV, it's not only preventing a virus, it's also something I have been taking daily to feel empowered, to feel healed, and to reduce my anxiety around the possibility of at some point acquiring HIV in my life. And so a lot of people choose to use it even when they're not sexually active, even when they're not having sex, because of that anxiety and because it helps to process some of the trauma. Now, I'm back on. I told you I stopped for 4 weeks, only because I needed that break. And after 9 years of using PrEP, I'm feeling pretty okay about that. But I know a lot of people are continuing to use it in quarantine because they still feel like it's something they want to do. It's a part of their mental health and their physical health. It's sort of the field of dreams idea. If I take it, he will come eventually. That's a Field of Dreams reference for those that might. And you know, I think it's just basically whatever people feel comfortable with doing is really important. But if you do become sexually active, if you are considering sexual contact, please use PrEP. Be aware of the 211 guidelines. That's what I'm using right now because I'm not having sex on a consistent basis, but I'm very aware that there's the medical science that shows that using event-based dosing as prescribed is very, very effective. And continue as able during the quarantine to get tested. Make sure you're still following as best as possible. I know it's not perfect right now, but as best as one can do is to follow the CDC protocol for using PrEP, which does include HIV testing every 90 days. And if you have stopped using PrEP for an extended period of time and you decide you want to restart, again, please do confirm you're HIV negative before you restart.
Yes.
If possible. I mean, we're talking about the best case scenario here, and quarantine is not the best case scenario. But if possible, when possible, please do get tested every 90 days.
Yes, and that's one thing I wanted to segue over to Noah to talk about testing. So if people were wanting to perhaps do like a home test, I know that those are available. What kind of, or like what brand would you recommend for a home test?
Yeah, we're looking at the OraQuick, which has a pretty high accuracy rate. I'm not actually familiar with all of the ones that are on the market. Is it okay if I just speak to the PrEP question real quick, Christina?
Very quick.
Okay. Well, then I'll skip it because it's more meeting therapy. So, but yeah, we're using the OraQuick one right now.
Okay. Yeah, I wanted to ask one more question, and I also wanted to have space for people watching to ask questions as well before 11. But Tanya, I've been thinking a lot about this right now because if in the times that we're in, you know, there's been unfortunately like a rise in domestic violence, intimate partner violence, and, you know, for following public health advice, you know, we're supposed to be quarantining, self-isolating, like we've been talking about, and there are people who may be with their abuser now, and they're being forced to quarantine with them. I just wanted to bring that into the conversation, and hopefully you can provide some tips as to how people could deal with that.
Well, the good news is that there's still resources that are operating, at least I know in North Carolina, where folks can get support. So the idea is that we are seeing an increase because there's more time possibly being spent. There's more tension in the home. There might be, you know, more, lack of a better word, family drama, or just the reality of being in a family when it might be children involved, or just spending more time for those tense situations to increase. But people can reach out still to, like in North Carolina, NC CASA or the Durham or any of the coalitions of the domestic violence, intimate partner violence agencies to get support. So the support is still there. It's just making people more aware of it and their likelihood of utilizing those services. And so even recently in Wake County, we just saw like an intimate partner situation where a young lady was thrown out of a car, or like pushed out of a car by her partner, and then he injured himself or harmed himself. So it's just important for folks to get the resources, let people know that the services are available, although they don't look like they normally look, but they're still available.
Thank you for sharing that. Before we open up more broadly for questions, I'll let Noah share his PrEP therapy situation.
Well, it just speaks to, I stopped taking PrEP. I thought, I'm a public health person. you know, I can do this. I don't need to have sex. A week later, had sex with this guy I really wanted to get with. Ended up having to go on PEP, which is, there's no shame in that either. Well, there was, I felt shame, but my doctor was like, do not be embarrassed, you know? So I'm taking it every day now. But I learned I'm not a, whatever a perfect person is, I'm a human, I have a body, and I can be as gentle with myself as I am with my clients, you know? So thanks, Christina.
Thank you. And that was definitely worth sharing, because I feel like a lot of us, particularly those who work in the HIV field, I feel like I definitely can see there being a level of shame or whatever with the whole PEP situation and, you know, getting tested and not. And it's just like, no, I think we should extend that same compassion and grace to ourselves as we do to our clients. Damon, I feel like you want to add something.
Yeah, I just want to say, Noah, thank you for sharing that. I really appreciate that. And that is, I run a group on Facebook. We have 21,000 international members talking about PrEP every day and night. And I've been hearing a lot about the experiences that Noah just shared, where people were thinking, okay, it's not going to happen. And then it does happen, and they do go on PEP. And again, no shame in that. But I just always think that PrEP works well psychologically when we feel we can be proactive and in control. And so I just, really want to appreciate Noah for saying that, and really want to encourage people to be aware. And I'm going to put the address for those who don't have it, or for those who don't know it, but I'm going to put in the comments. So if people want to come to Facebook and continue this conversation beyond the webinar and keep thinking and talking about these things in a supportive community, they can do so. And I'm just sending it through right there.
Thanks, David. Thank y'all for sharing. This has been such an awesome conversation. Are there any questions that haven't already been answered? So I know there were some earlier that were answered in the chat. Are there any questions that people have for our panelists? This is not the day to be shy, y'all. This is not the topic to be shy on.
Ask anything. You won't hurt my feelings. Ask a Travada horror. I don't care. This would be the place to do it.
Well, I mean, I have a question. I've been, especially in preparation for this webinar, I've been like monitoring social media and looking at a lot of messaging that's been going out there. And it seems to be so conflicting. Like, I feel like people are very much like either don't do it or do it. And there's a lot of, I feel like, shaming to some degree on both sides. And I feel like that's, like, we kind of like talked about it a little bit, but I feel like as providers, like, if people ask you, how do you go about having that conversation? Is it more just, you know, trying to meet them where they're at, or do you feel pressure to stick to the guidelines that have been given? Because I feel like there's been a lot of just confusing, conflicting information out there. That's right.
It is conflicting. It is confusing. In New York City, we're getting different information almost every day. We went from 4 weeks of don't wear a mask to now you have to wear a mask. It's not clear. And I am one who always feels like I can't tell you or anyone what to do with your body. What I can do is, if you're going to do something with your body, or you're feeling like you might do something with your body that might cause harm for yourself and others, can we talk about that first? Can we have a conversation first? Not because I'm going to tell you to do it or not to do it, but can we explore together tools that can help you live your life and not hurt yourself and hurt other people?
Ooh, okay. One question came in. Sorry. That's good. It's for Damon and Noah. If I have sex with a guy with a condom, doggy style, no kisses, did you say that I'm having safe sex in this social distance time?
I get this question a lot. And, you know, it's so ironic because that used to be considered. I mean, I generally talk about with PrEP, condom or not, PrEP works. That used to be something that was risky, and now it's like that might be, in the age of COVID, some of the safest sex you can have if there's no kissing involved. I did ask a doctor friend of mine who's working in the emergency rooms at Woodhall here in Brooklyn that very question. And he said, you know, the only thing there that could be is if you're in that position and the guy is breathing heavy on your back and he's like coming and he's drooling and he, you know, he like letting out droplets while he is having sex with you, while you're on your knees, no kissing, but he's still releasing droplets on your back, it could still be on your back. And, you know, again, this is so, apparently COVID is so contagious that once it's on your skin, it's possible that you could still somehow inhale those droplets, even if he just only breathed them on your back. So, you know, is there a definitive yes or no? No, but he just told me when I asked this very question, he said that would be the concern.
That's fair.
Damon, I appreciate that answer because even if you think about it, you're breathing in the same space, right? Like, so that's very good.
You're breathing. You know, when you have sex, you breathe heavy, and sometimes you spit and you drool, and a lot of other things. And that all contain the droplets that we're so worried about with COVID.
Noah, is there anything you wanted to add? No. Okay. All right, we are at 11:02. I don't see any other questions, so I guess we'll just wrap it up. Thank you all so much for joining. This was really great. Thanks again to Damon and Tanya and Noah for sharing and bringing a lot of great conversation and a lot of topics. And thank you so much for being so open and vulnerable and sharing today. One plug, I know next week we have another webinar on the Medicaid program. So please come and join us because there have been a lot of changes that have been going on that are to go on, particularly here in North Carolina. And, you know, that's going to have a huge impact on a COVID-19 response and the healthcare of our people. So please come and join us. We'll be joined by an organization called Community Catalyst, who do healthcare policy on the federal level. So they'll be joining us. So, and also Nicole Dozier from the North Carolina Justice Center. So we have some local folks, some federal folks, and it's going to be also a great conversation. All right, we'll wrap up. Thanks again, y'all.
Thank you, everybody, for all the great work you're doing.
Thank you. Damon, I'm from Brooklyn. I forgot to tell you.
Oh, wow. All right, I'm here. Yes. Talk to you soon. Thank you.
Okay, bye.
Bye.
Hey, Sharon, I'll text you.
Be safe.